Welcome back to Great Day Washington. If you are dealing with chronic pain, you are certainly not alone. According to the Institute of Medicine, more than 100 million Americans are dealing with chronic pain.
That is a huge number, but our next guest says you don't have to suffer. He is Dr. M. Scott White from New Life Laser. Welcome, doctor. Thank you so much for coming. And you also brought a friend.
Yes, I did.
He's dressed very well. He's a little robot. Okay, what else? He can heal people or help people feel better, right?
Yeah, this is an amazing tool. I've been in practice for over 31 years. I've used lots of different types of laser. This laser doesn't cut. It's not like eye surgery or cutting with a laser. This is transdermal. It goes through the skin. There's no downtime, there's no pain, no negative side effects. It actually goes about 5 inches into the tissues, draws out inflammation, and as you know, we were talking about it, almost all pain in the body comes from inflammation. So it draws out inflammation, but it does something more than just relieve symptoms. A shot can relieve symptoms, medication can relieve symptoms, but this can actually cause healing. It speeds up the metabolic activity of the cells, the mitochondria, those little sausage-shaped things you may remember from biology.
Okay.
They're stimulated by the laser, and they actually produce ATPs, or energy, at a large rate, stimulating the cell to heal itself. It also turns on stem cells. But one of the most important things is it puts blood supply, or angiogenesis, back into stagnant, decaying areas. So one of our big problems with aging is that when God created our bodies, there's not a good blood supply in knees, hips, or the discs in the spine. So we've got an epidemic: knee replacements, hip replacements, spinal surgery. This laser is able to put blood supply back into areas that don't normally have a good blood supply. So healing can ensue.
Interesting. Now, so what I heard when you said 5 inches is that this is a deep tissue laser. Are there different types of lasers for different parts of the body?
No, there are different types of lasers. Over 31 years, I've used a lot of the lasers. This is the latest, the greatest. It's actually provided by a company called Cutting Edge. I had one of these lasers for a couple of years, and I had other types of lasers. What we found was we wound up using this for the problem cases. And then when people used this laser, they didn't want to go back to the others. So now I own 11 of these, more than anyone in the world, in all of our clinics. And it's truly an amazing device. Does
it hurt? When you
No, totally pain-free.
Back pain hurts. I see you have a model over there.
Right,
I can see what the degeneration or deterioration of the soft stuff in between the bone. It really starts to get to hurt.
Yeah, and you know, the whole thing is no pain, no downtime. This laser most lasers are about a watt of power. This is 25 watts. And the amazing thing is, it's robotic, meaning there's no human variability. The doctor sets the machine, it does the exact pattern of the treatment every time, the right dosage, so it's amazing.
Now, I want to know about people. My father-in-law's girlfriend suffers from back pain. So can this laser help if back surgery, traditional surgery, doesn't help?
Yeah, another amazing thing is, again, there are no negative side effects to this. So we can use this on failed back surgery. We see tens of thousands of cases of failed back surgery. Everybody's trying to hurt, but you know what? Back surgery doesn't work real well sometimes. So this will work around where the metal is, the screws, the plates, with no negatives. Also, people that have had diabetes, heart disease, that can't do some of the more invasive procedures, this is safe for them. But you know, we talked about the degeneration.
Yes.
You know, again, the way our bodies are designed, once we reach the age of 6 to 8 years old, there's not a good blood supply in knees, hips, or discs. So I call this anti-aging, because what can happen is, as we put blood supply back into the damaged tissues, they can heal and regenerate. So here we have a model, a nice thick disc, and over time, the discs can decay. But with the laser putting blood supply back in it, you know, we can get healing. So it's not just covering up symptoms like a pill or a shot.
Oh, cortisone. Oh, that's a cortisone. You can only get like 3 a year, can you?
Yeah, you know, if you can only do things three times a year, it's either really good or really bad, and cortisone is really bad.
It's what they have, but it's tough for you. You
so
can't
this
really...
is a better option, because what it does is not just cover up pain, but can cause cell regeneration and tissue healing. So you're healing something, not just covering it up.
That is wonderful, especially people are living longer than ever before, and they want to be active. Doctor, thank you so much. I want to tell people about a special offer that you have, okay? Listen up, Great Day viewers. We have a special offer, okay? Call 1-888-PAIN-FREE right now and mention that you saw Dr. White, DC, on this show, and you will get 2 free robotic laser treatments. That's huge. 1-888-PAIN-FREE. The offer only lasts 2 hours. So give them a call right now and get rid of your pain. Okay, stay tuned because up next we get some insight